Welcome to the deep dive. Today we're tackling something that probably hits close to home for a lot of you listening. Canine lameness.
Yeah, it's a really common issue.
Absolutely. And you've shared some great detailed medical info on this. So our goal today is to really dig into the fundamentals. We want to go beyond just seeing a dog limp and, understand what's actually happening.
Yeah, what might be causing it, how vets figure it out.
Exactly. And we'll be drawing straight from these medical excerpts you sent over, which seem to focus on the basics and the diagnostic side of things.
That's right. It's good foundational stuff. It should let us explore, the different aspects of lameness from just defining it to the steps needed to find the cause.
Okay, let's start right there then. The basics. So the medical definition talks about a disturbance in gait, in how they move, and it seems to boil down to three things: pain, an anatomical issue, or an injury.
Right.
But what really jumped out at me was how differently pain can show up. It's not always obvious, is it?
No, not at all. And that's crucial. Really bad acute pain, the dog's probably holding that leg right up, not wanting to put any weight on it.
Okay.
But milder pain, maybe something chronic, might just be a subtle thing. Favoring the leg slightly, putting less weight on it, or maybe the paw isn't on the ground for quite as long during each step.
So tiny changes can mean something.
Definitely. Owners noticing those small shifts is really key for catching things early.
Right. And the definition also mentioned lameness from an anatomical disruption, not just pain. Can you unpack that a bit?
Sure. So sometimes it's not about a pain signal firing, it's about the structure itself. Maybe a joint didn't form right or it's damaged.
So it just can't move normally.
Exactly. Whether it's actively painful right that second or not, the mechanics are just off. The limb can't function the way it's supposed to.
Got it. So when a dog is lame, what systems are we talking about being involved? It's more than just the leg bones, I assume.
Yeah. Primarily, the sources point to the musculoskeletal system. That's your muscles, bones, ligaments, joints, the obvious players.
Mm-hmm.
But, and this is important, the nervous system is almost always involved too. It's sending the pain signals, or it's controlling the muscles needed for movement. So if there's a nerve issue, that can look like lameness too.
So they're intertwined?
Very much so.
And this can happen to any dog, right? Age, breed, doesn't matter.
Broadly speaking, yes, any dog can become lame. But the sources do highlight that certain breeds, certain ages, they are more prone to specific conditions that cause lameness.
Okay, that makes sense. Predispositions.
Yeah, and that's a useful clue during diagnosis.
So thinking like an owner again, what visual cues should I be looking for? What screams lameness?
Well, the sources give some classic signs. If it's a front leg, just one side, look for that head bob.
Head bob.
Yeah, the head goes up when the sore leg hits the ground and down when the good leg takes the weight. It's pretty noticeable once you know what to look for.
Okay, I can picture that. What about a back leg?
For single back leg, you watch the hip or pelvis on that side. It tends to drop lower when that affected leg is bearing weight.
A pelvic drop.
Okay, and rise up when the healthy leg takes over. And if both back legs are sore, the dog might lower their whole front end, kind of shifting weight forward onto those front legs.
Trying to compensate.
Exactly. Recognizing these little biomechanical tricks they use can really help you realize something's wrong sooner rather than later.
That head bob is a really strong visual. Now, the notes also mention checking neurologic status, especially if the issue seems higher up the limb. Why is that so important?
Yeah, that brings us back to the nervous system connection. If the lameness seems to originate closer to the spine, it could actually be a nerve problem causing it.
Like a pinched nerve or something?
Could be. Or inflammation, disc issues, other neurological things affecting how the limb works. So a good neuro exam helps sort out if it's primarily a nerve issue or a bone joint muscle issue, or maybe both.
Okay, that clarifies things. So we've watched the dog move. What about their history? How critical is that information?
Oh, absolutely fundamental. The history is gold. Was there an obvious injury? Did they fall or twist something?
Right.
How does weather affect it? Does it get worse after exercise? Better with rest? Have they had treatments before, and did they help? All these details are vital clues.
And the source is really stressed looking at the onset, how quickly it appeared.
Precisely. Was it sudden? Like fine 1 minute, limping the next, maybe after playing hard?
Or gradual.
Or did it creep up slowly over weeks or months? Is it getting worse, staying the same, or does it kind of come and go?
Intermittent versus constant.
Exactly. These patterns point towards different types of underlying problems, and even understanding how your particular dog shows pain. Some are really stoic, others are very vocal. That helps interpret what you're seeing.
Okay, so history is crucial. Then comes the physical exam at the vet's. What does that involve after the observation?
Right. The exam proper, this is where we get hands-on. It actually starts with more observation, but close up. How do they stand? How do they get up from lying down? How do they sit?
Looking for stiffness or odd postures.
Yes. Then we watch them move again, usually walk and trot,
Yeah.
sometimes upstairs or in tight circles, figure eights, to really make the lameness more obvious.
And then you start feeling the limbs, palpation.
Correct. Palpation. We're feeling carefully for differences in muscle bulk. Is there atrophy, muscle loss on the sore side?
And the sources mentioned measuring.
Yes. Actually, measuring limb circumference can be really objective,
Yeah.
comparing sides. We also feel along the bones any swelling, heat. Does touching a certain spot hurt? Then we move each joint systematically, usually starting down at the toes and working our way up.
Okay. And when you're moving those joints, what are you specifically checking for?
Several things. We're feeling for any instability, like does the joint feel loose or move in ways it shouldn't? Is there incongruency? Does it feel like the surfaces aren't gliding smoothly?
Like a grinding feeling.
Sort of, yeah, or just not quite right. We're obviously noting any pain responses. We check the range of motion, how far can it flex and extend. Again, measuring that can be useful later.
To track progress.
Exactly. And finally, we're listening and feeling for any weird sounds, clicks, pops, crepitus that might suggest something's wrong inside the joint.
I saw a note about examining the good limbs first. Why start there? It seems a bit backwards.
That's a great point. It might seem counterintuitive, but the idea is to let the dog relax. By starting with the limbs that don't hurt, they're usually less tense, less worried.
Ah, so you get a better feel for their normal.
Precisely. You establish a baseline, then when you examine the sore limb, you have a much better comparison, and you're more likely to detect subtle pain responses or abnormalities because the dog isn't already tensed up.
That makes a lot of sense. Okay, let's dive into the causes. The sources break them down by age, under 12 months and over 12 months. Seems logical, different problems at different life stages.
Yeah, it's a helpful way to think about it.
So for young dogs, puppies under a year old with forelimb lameness, what are the big things vets worry about?
In growing dogs, you see a lot of what are called developmental orthopedic diseases. Things didn't quite form right as they grew.
Like what specifically?
Well, osteochondrosis is a big one. It affects cartilage, often in the shoulder or elbow. You can get congenital shoulder issues like looseness, luxation, and the elbow, well, the elbow gets a lot of attention in young dogs.
Yeah, I noticed a list for the elbow.
Right. Things like an ununited encomial process, a bit of bone that doesn't fuse, fragmented medial coronoid process, tiny fractures inside the joint, elbow incongruity, where the bones just don't fit together perfectly, all common causes of elbow pain and lameness in pups.
Wow, the elbow's complex. Anything else for young front legs?
Oh, yeah. You can see problems with muscle tendons near the elbow, like avulsions or calcification, uneven growth of the two forearm bones, the radius and ulna.
That sounds painful.
It can be. There's also panistitis, often called growing pains. It's inflammation in the long bones.
Mm.
Hypertrophic osteodystrophy, another bone growth issue. And, of course, plain old trauma, injuries, infections, nutritional problems, other congenital stuff.
Okay, quite a list. What about hind limbs in puppies? Similar themes.
Similar themes, different specifics sometimes. Hip dysplasia is a major one, especially in larger breeds.
Heard of that one.
Yeah, very common. Also, leg-calf-Perthes disease that affects blood supply to the top of the femur, the thigh bone. Osteochondritis can hit the stifle, which is the knee, and the hock or ankle. Patelloluxation kneecap slipping out of place is pretty common too.
So joint issues are big in young dogs, front and back.
Very much so.
Right.
And again, add panistitis, hypertrophic osteodystrophy, trauma, infection, nutrition, congenital anomalies to the hind limb list too. It's just a vulnerable period during rapid growth.
Okay, let's switch gears to mature dogs, over a year old. What about forelimb lameness in adults? What pops up more often then?
As dogs get older, we definitely start seeing more degenerative problems. Wear and tear takes its toll. So, degenerative joint disease, osteoarthritis, is a huge cause, often linked to earlier issues, maybe mild hip dysplasia they had as a pup, or just aging.
Makes sense.
Then specific things like bicipital tendinosynovitis, inflammation in the biceps tendon in the shoulder, calcification of tendons around the shoulder, sometimes muscle contractures. And sadly, we also have to think about tumors, bone, or soft tissue cancer, either primary or spread from elsewhere.
Right. And injuries still happen, presumably.
Absolutely. Trauma is always on the list. Panistitis can still occasionally show up. And then systemic inflammatory things like polyarthropathies, where multiple joints are inflamed, or polymyositis affecting muscles, or polyneuritis affecting nerves.
Gotcha. And for hind limbs in adult dogs, similar pattern.
Very similar pattern. Degenerative joint disease is, again, a top contender, often related to hip dysplasia. Cruciate ligament disease, tearing that key knee ligament, is incredibly common in adult dogs, a major cause of hind limb lameness.
Yeah, I know a few dogs who've had that surgery.
It's very frequent. You can also see things like avulsion of a specific tendon in the hock, the long digital extensor. And again, tumors, trauma, panastatus sometimes, and those systemic inflammatory conditions, polyarthropathies, polymyositis, polyneuritis.
Okay, that's a really thorough overview of the what. Are there general risk factors that make a dog more likely to end up with lameness?
The sources mention a few key ones. Breed is definitely a factor, size, conformation. Certain breeds are just built in ways that predispose them to joint problems.
Like larger breeds, maybe?
Often, yes. Being overweight is another big one. Extra pounds mean extra stress on every single joint, day in, day out. That increases injury risk and speeds up degeneration.
Makes total sense.
And finally, activity level and type. Really strenuous, high-impact stuff can increase the risk of acute injuries and chronic wear over time.
Right. So given this huge list of potential causes, how do vets actually narrow it down? How do they pinpoint the real problem?
That's the art and science of the diagnostic process. It starts with building that differential diagnosis list based on the history in the exam. What are the most likely culprits for this dog?
And you have to consider things beyond just bones and muscles.
Absolutely. Is it musculoskeletal? Or could it be neurological? Maybe even metabolic. You have to keep an open mind initially.
Then come the tests, I imagine, like blood work. What can that tell you?
Standard blood tests, CBC, chemistry panel, and a urinalysis give a good baseline. They can flag inflammation, infection, sometimes organ issues that might be relevant. The sources specifically mention checking creatine phosphokinase, CPK levels.
What does that indicate?
ICPK often points towards muscle damage or injury. And depending on suspicions, more specific blood tests might be run for particular infectious diseases or immune conditions.
Okay. And imaging must be huge for lameness. X-rays.
Oh, definitely.
Yeah.
Radiographs, X-rays are usually the first go-to imaging. Standard practice is at least 2 views of the area, say side view and front-to-back view.
To get a better picture.
Exactly. But X-rays mainly show bone well. If we suspect soft tissue problems, ligaments, tendons, cartilage, or need more detail, then we move to advanced imaging.
Like CT scans or MRIs.
Precisely. CT gives great bone detail in 3D. MRI is fantastic for soft tissues. Ultrasound is also really useful for tendons, ligaments, and fluid in joints. And sometimes nuclear scintigraphy, a bone scan, can highlight areas of active inflammation or turnover.
So lots of tools to see inside. What about actually sampling things, like joint fluid?
Yes, joint fluid analysis arthrocentesis is very valuable if we suspect a problem inside the joint itself.
Like infection or arthritis.
Exactly. Looking at the cells and fluid characteristics under a microscope tells us a lot about inflammation or infection within the joint.
And you mentioned nerve or muscle issues earlier. Are there tests for those?
There are. If a neuromuscular cause is high on the list, an EMG, electromyography, can help. It checks the electrical activity in muscles to see if the nerves supplying them are working right.
Okay.
And in some tricky cases, a muscle or nerve biopsy might be needed for a definitive diagnosis of certain neuromuscular diseases.
Wow, okay. So it can be quite a workup to get to the answer. Once you have a diagnosis, how is lameness generally treated? It must vary wildly.
It absolutely does. The treatment has to target the specific underlying cause. There's no one-size-fits-all approach.
But medications are often involved, right, for pain and inflammation?
Very often, yes. Medications are key for managing comfort and reducing inflammation. The sources mention analgesics, which are painkillers, and NSAIDs.
Non-steroidal anti-inflammatories.
Right. NSAIDs are workhorses for musculoskeletal pain because they tackle both pain and the underlying inflammation. The notes even gave examples like meloxicam, carprofen.
Celecoxib, too, for post-op pain.
Exactly. These drugs reduce the body's inflammatory cascade and block pain signals, providing significant relief from many conditions.
That's helpful. Are there downsides or things owners need to watch for with NSAIDs?
Yes, definitely. It's important to know they can have side effects. Stomach upset is the most common, but they can potentially affect kidney or liver function too, especially with long-term use.
So following vet instructions is crucial.
Absolutely critical. Correct dosage, administration, and monitoring for any signs of trouble, loss of appetite, vomiting, diarrhea, lethargy. Sometimes vets recommend regular blood tests for dogs on them long-term.
Good to know. The sources also mentioned chondroprotective drugs. What's the story with those?
Ah, the joint supplements, things like glucosamine, chondroitin sulfate, polysulfated glycosaminoglycans. These are considered chondroprotective, meaning cartilage protecting.
How are they supposed to work?
The idea is they might provide building blocks for cartilage, potentially slow down its breakdown, maybe help with joint fluid health. The evidence is, well, debated for some, but they're often used as part of a multimodal approach for arthritis, generally considered safe.
Or the bigger picture?
Exactly. Often used alongside NSAIDs, weight management, appropriate exercise.
And lastly, follow-up. What does that usually involve?
It really hinges on the diagnosis and treatment. It could be recheck exams to see how the dog's moving, maybe repeat x-rays to check bone healing after a fracture, or follow-up blood work if they're on long-term meds.
So, monitoring progress and watching for side effects.
Precisely. The goal is making sure the treatment is working, the lameness is resolving or being managed well, and the dog is doing okay overall.
Okay. So, stepping back from all the details, this deep dive really underscores that lameness in dogs isn't simple. It's not just a limp.
Not at all.
It can come from so many different places. Developmental stuff in puppies, injuries, wear and tear diseases in older dogs, even nerve issues or systemic problems.
A huge range of possibility.
And getting it right means careful observation, a really thorough exam by the vet, and often using some pretty advanced diagnostics to figure out that root cause before you can treat it effectively.
Exactly right. It demands a systematic approach, pulling together all the clues to get the full picture and decide on the best path forward for that individual dog.
This has been incredibly informative, really helpful, and thinking about everything we've discussed, all those potential causes, it does make you wonder, doesn't it? What proactive things could owners even do to try and support their dog's musculoskeletal health long term? Give them the best shot at staying sound.
That's a great question to ponder.
Definitely food for thought. Thanks so much for walking us through all of this today.